basically this is to protect unvaccinated people and vaccinated people from then infecting those who are unvaccinated. But if even vaccinated people have to wear their mask, doesn't that remove some incentive for those that haven't gotten their shots yet? Why would they do it if they're still going to have to mask up?
Yeah, I mean, it's really unfortunate that, you don't get that benefit of being vaccinated and going without a mask. But, right now we don't have the vaccination rates that we need to have to be able to put that incentive back. And with Delta, it's more transmissible. It looks like people who are infected have a lot more virus in their nose, so they're breathing a lot more out. And so with kids being unprotected generally, it's really kind of what has to happen.
So I have seen a lot of studies, Dr. Gronvall, pointing out that kids don't get severely ill from COVID, as well as the fact that the vaccinated don't get severely ill from COVID. I don't know any numbers, specific data backing that, but can you tell us, for example, what are the chances of me as a vaccinated person, or say my nephew who's 11, getting severely ill from COVID?
Yeah, so I mean, kids do much better than adults, but I think that if we had no adults or no seniors who are afflicted with this disease, people would be pretty concerned about the effect that it has on kids. There are kids, 1 in 1,000 infections that get long COVID. We don't know what's going to happen in the future. There's a lot of unknowns with this new virus. So what are we going to see 20 years, 30 years, 40 years down the road? And so I think the kids need to be the most protected group here. And I would love to see vaccine accelerated for children, because I think now the risks are higher to be unvaccinated.
A lot of uncertainties, of course, but I'm wondering if there are any lessons to be learned from the Delta variant as it spread in India. Began in March, it peaked, it ended around mid-May in terms of the peak of the severity. Could we look at that model and say, okay, the CDC guidance for more masks, just how temporary or long will that need to happen?
Right. We're already seeing some dips in the UK and Israel. So, I mean, clearly these public health measures are working. I'd like to see a lot more vaccine, though, a lot more people taking up the vaccine. So we're starting to see more mandates, workplace mandates. I think that's an excellent idea. The time for the carrots are still there, but we need to protect the people who are can't be vaccinated, and give the people who have already stepped up a break.
Doctor, you mentioned Israel there, which is one of the places that is now offering a third vaccine shot to people who are immunocompromised. You also have places like the Dominican Republic now offering a third shot to people. Is that something that here in the U.S., the Biden administration and the CDC should be more seriously considering?
I think it is under consideration for certain groups of people. So people who have had liver transplants, for example, they may benefit from a third shot. And a lot of people have already taken this advice on the advice of their doctors. But for most people, the shots that we have are sufficient. We need to be doing more to make sure that we vaccinate the world, because we're just going to keep going through this as long as we don't make more of the global population immune.